No more schizophrenia. Schizophrenia is a brain disease. Schizophrenia affects the patient's thoughts and brain function, thus affecting the patient's connection with reality. Schizophrenia often first occurs in young people. Most cases of schizophrenia occur between the ages of 20 and 30, with men developing the disease 3 to 5 years earlier than women. Like other medical diseases, schizophrenia is treatable. In fact, earlier diagnosis and good treatment can lead to ideal recovery for patients with schizophrenia. There are different types of schizophrenia on the diagnostic spectrum, including schizophrenia, paranoia, schizoaffective disorder, manic depression, drug-induced schizophrenia, functional schizophrenia. Before the onset of schizophrenia, the patient may experience a short period of confused thinking, quasi-schizophrenia. The symptoms of schizophrenia may make the patient frightened, upset, or even distressed. Patients who experience symptoms of schizophrenia for the first time may have difficulty understanding these confusing and unfamiliar feelings. Schizophrenia, which is part of the schizophrenia category, is also a disease that affects the brain and affects about 1% of the general population. Its main symptoms include hallucinations, delusions, and disordered speech and behavior. At the same time, patients will also have obvious obstacles in social and work. These symptoms are believed to be caused by the disorder of the activities of various chemical substances in the brain nerves, including the overactivity of a substance called dopamine. Like complex physiological diseases such as diabetes and cancer, the interaction between innate vulnerability of the individual's brain and external environmental pressure contributes to the occurrence of schizophrenia. Family inheritance is the main cause of innate vulnerability of the brain. If a person's brain is inherently prone to schizophrenia due to genetic factors, when faced with external mental pressure, the brain reaches a level that it can no longer bear, and schizophrenia occurs. In addition to mental stress, external environmental stress can also come from the toxicity of drug abuse, such as taking marijuana, to the brain. The symptoms of schizophrenia can be divided into two categories: positive symptoms and negative symptoms. Positive symptoms include delusions, hallucinations, and disordered speech and behavior. Delusions refer to confusion in thinking, such as believing in some erroneous ideas that are inconsistent with facts, violate logic, and cannot be explained by the social culture in which one lives, such as religion, customs. Hallucinations refer to a person hearing, most common, seeing, smelling, or physically feeling something that does not exist. This is a sensory abnormality. Negative symptoms: there are emotional dullness, lack of positivity, and abnormal poverty of thought. In addition to positive and negative symptoms, patients also experience impairment of brain cognitive abilities, such as decreased concentration, judgment, and memory. These symptoms greatly reduce patients' social and work abilities.